Okay, let's look at this case, and we are looking at the cross section of the cervical spine MRI. And this is the front of the neck, this is the and back of the neck, and this is the disc space. Behind the disc and the round structure, this is the one I'm talking about, is the spinal cord. And which is surrounded by this white material, which is cerebrospinal fluid, which is typically a good thing. And now on the sides there are tunnels, one on each side, through which the nerves exit out of the spinal cord and they go to the patient's arm. And now we are looking at a different level where you can see this extra material coming out of the disc space and kind of occupied some space in the spinal canal, especially on the right side, right tunnel we are looking at, and through which the nerve is exiting. Now we have this extra material which is impinging upon that nerve, which resulted in patient's radicular symptoms on the right side. As you can see, there's also a component of a central portion of the disc material. This is the one I'm talking about, but it's touching the spinal cords, but it's not causing any significant compression of the spinal cord. So that's the reason why a patient primarily presented with the radicular symptoms in his right upper extremity. So the question is, what can we do to treat his condition? And we discussed various treatment options. The most important thing is that patient has already failed conservative treatment, and what we discussed about, hey, we can actually go approach the spine from the front and remove all of this disc material all the way in the back of the spine and decompress the nerve and the spinal cord, and put the cage and screw and a plate to fuse the spine, which we call ACDF, versus and just we remove the disc, decompress the nerves and spinal cord, and instead of fusing it and put in a disc replacement device so that the mobility at that disc space is maintained. Um, that being said, the alternative is, hey, can we do the endoscopic spine surgery? I mean, this we discussed that option too. In that case, we actually go from the back of the spine, remove this the disc material. But the problem with endoscopic spine in this particular case is there is actually a central portion of the disc which we cannot access with endoscopic spine surgery. So between ACDF, which is a fusion surgery, and artificial disc replacement, we actually chose artificial disc replacement considering patient's young age. And this is what we ended up doing. We actually performed a discectomy, removed all of the disc all the way to the back of the spine, and decompressed the spinal cord and the nerves, and replaced the disc with this artificial disc replacement device. And I saw this patient today at 2 weeks post-op, and he was doing very good. And his radicular symptoms in his both hands have significantly improved.